Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
We talk so much about colorectal cancer screening, right? Especially for folks as they get older. But what if I told you there are more and more people getting diagnosed with this before they even hit that recommended screening age? Crazy, huh?
Yeah, it's kind of a head scratcher, isn't it? Like, we've done such a good job bringing down the overall colorectal cancer numbers with those screening programs for, older folks. But then we see this alarming trend, this early onset colorectal cancer. And a pretty big chunk of these new cases are happening people younger than 50.
Exactly, and that's why this deep dive we're doing today is so important. We're going to dig into some really cool research that came out of the Cleveland Clinic. It was published in Digestive Diseases and Sciences. And this study, what they did was they focused on developing a new risk score specifically for adults under 45. And the goal, they wanted to predict how likely someone in that age group is to have these advanced precancerous growths, polyps, or even get diagnosed with actual early onset colorectal cancer.
This research is exciting stuff. It's like moving us away from this one-size-fits-all idea about screening. Because by zeroing in on these individual risk factors, we can maybe, hopefully, tailor those screening recommendations, make them fit each person better.
I like it. So how did they even go about, building this risk score?
Well, they took a look at a ton of data, over 9,400 patients, all between 18 and 44 years old. And these folks had all gotten colonoscopies at the Cleveland Clinic over a 10-year period.
Wow, that's a lot of data.
It is. And by digging into these patients' medical records, they were really looking for links, connections between certain factors and whether those polyps were present, those precancerous growths, or if they had colorectal cancer already.
So they were basically playing detective, trying to find those patterns in a sea of information.
Yeah.
And what did they uncover?
Well, they found 4 main risk factors that really jumped out. These were linked to a much higher risk of having those advanced polyps or early onset colorectal cancer. The first one, and this might seem kind of obvious, is family history. So if you've got a parent, a sibling, or a child who's been diagnosed with colorectal cancer, especially if they were diagnosed before 60, your own risk shoots up.
Yeah, that makes sense. I mean, we all know that genetics can be a big deal when it comes to cancer.
Absolutely. The second risk factor they found was body mass index, BMI. Being overweight or obese, well, it's linked to a higher chance of getting colorectal cancer.
Seems like that's a pretty common theme with a lot of health problems these days, unfortunately.
It's true. And the third one, this might be a bit of a surprise for some folks. A study found that men have a slightly higher risk of developing this early onset colorectal cancer compared to women.
Interesting. Any ideas why that might be? Did the study look into that?
They didn't really dig into the why of it, unfortunately, but it definitely shows us, hey, we need more research here. Got to figure out why some groups seem to be more vulnerable to this disease than others.
Yeah,
right?
absolutely. Okay, so we've got family history, BMI, and being male. What's that fourth risk factor they found?
Smoking. Both current and former smokers, their risk of early onset colorectal cancer was higher.
Ugh, smoking. It's like the bad guy in every health story, isn't it?
Pretty much. It does so much damage to our bodies, and this study just adds another reason to kick that habit to the curb.
I'm with you there.
Yeah.
Now, let's talk about the heart of this research, the risk score itself. How does this thing actually work?
Okay, so each of those 4 risk factors we talked about, they get assigned points. And the points depend on your situation. Like, if you've got a close relative, that first-degree relative who got colorectal cancer before 60, well, you'd rack up some points for family history, right? And then you add points based on your BMI, whether you're a guy or a gal, and if you smoke or used to. So you add it all up. The higher the score, the higher your chance of having those advanced precancerous polyps or early onset colorectal cancer. The total is out of 12 points.
So it's personalized, right?
Yeah.
Takes into account your own unique mix of risk factors. But how do we make sense of these scores? At what point should someone be worried? What's considered high risk?
Well, according to the researchers, a score of 9 or higher, that translates to a risk of over 14%.
Yeah.
To put that in perspective, that's a lot higher than the average risk for people in this age group.
Wow, that's pretty eye-opening. So if you've got a score of 9 or higher, it might be time to chat with your doctor about maybe starting screening sooner than 45, right?
You got it. This score could totally change how we think about colorectal cancer screening. I mean, it could help us find those folks who might benefit from earlier screenings, even if they're still on the younger side.
It's all about catching things early before they have a chance to become a bigger problem.
Exactly. But before we get too excited, we do need to remember that every study has its limitations.
Right. No study is perfect.
Hmm.
So what are some of the things we need to keep in mind about this one?
Well, this particular study was all done at one place, the Cleveland Clinic. And most of the patients in the study were white and non-Hispanic.
So we have to wonder, would the risk score be as accurate for other groups, folks from different backgrounds?
Exactly. Until we have more research with more diverse participants, it's tough to say for sure how well this risk score would work for different ethnicities and racial groups.
That makes sense. Were there any other limitations that stood out to you?
The fact that information about alcohol, tobacco, and aspirin use came from medical records, that's another thing to consider.
Right. Sometimes what people remember and what's actually in their records, they don't always match up perfectly.
Yeah. And those inconsistencies, they could definitely affect the results. But to be fair, the study authors were really upfront about these limitations, and they stressed the need for more research to iron those things out.
It's always a good reminder that science is a process.
Yeah.
Right? We're constantly learning and refining our understanding.
Couldn't have said it better myself.
So we've talked about the background, the how they did it, the key findings. But what does this all mean in the real world? How could this risk score actually change things on the ground in doctors' offices, in practice? That's what we'll be digging into in the next part of our deep dive.
What's really cool about this research? It's like it brings together this cutting-edge technology and this idea of personalized medicine.
Oh, I'm curious about that. Tell me more.
So think about it. To make sense of all that data, from all those thousands of patient records, the researchers, they had to use something pretty powerful, right? They used artificial intelligence. Yeah, and specifically something called natural language processing.
I've heard that term before, natural language processing. But what does it actually do?
Okay, so picture this, right? You've got a computer program that can read human language, like what we're using right now, but it can also actually understand what those words mean. That's basically natural language processing in a nutshell. In this study, they used it to go through tons of colonoscopy reports. It was pulling out all the important details about those polyps, what they looked like, what the diagnoses were.
Wow, that sounds incredibly efficient. Like way faster than a human could do it.
Oh, absolutely. They even said the accuracy rate was over 95%. Pretty impressive, huh?
Yeah, that's amazing. So instead of having like a whole team of people trying to read through stacks of medical records, this artificial intelligence thing can just zoom through it all, and it's super accurate. That's game changer for research.
Totally. It lets researchers look at huge amounts of data, find those hidden patterns that we might miss otherwise, and basically just speed up the whole scientific discovery process.
Okay, so we've talked about how cool this technology is, but I know we touched on some of the study's limitations earlier. Can we dig into those a bit more? What do those limitations mean for applying these findings to a wider group of people?
Sure. So, like I mentioned before, the folks in this study were mostly white and non-Hispanic. That means we can't be totally sure if the risk score would be as accurate for other groups, people with different backgrounds.
It makes you wonder, right? Are some risk factors more common in certain populations than others? Or could there be cultural or genetic factors that we're not even thinking about?
Exactly. And until we have more research that includes people from all sorts of different backgrounds, it's hard to say for sure how well this risk score would work for different ethnic or racial groups.
That makes sense. Anything else? Any other limitations that we should be aware of?
Well, remember how they got the information about alcohol, tobacco, and aspirin use? It came from those medical records. And sometimes that can be a little iffy.
Oh, right. What people tell their doctors and what ends up in their records, it doesn't always line up perfectly.
Exactly. And those little differences in what gets reported, well, they could throw off the results. But to be fair to the researchers, they were really open about this. They even talked about some really interesting directions for future studies.
Like what kinds of things?
Well, they're interested in refining the risk score, maybe adding more risk factors into the mix. And they even talked about creating like a user-friendly online calculator.
Oh, an online calculator. That would be awesome. Imagine just being able to plug in your information and see your personalized risk right there on your computer or phone.
Right. That would really give people the information they need to be proactive about their health and have those important conversations with their doctors.
Speaking of doctors, besides those 4 risk factors we talked about, what are some other things people might want to chat about with their doctor when it comes to colorectal cancer screening?
Well, it's always a good idea to give your doctor a complete picture of your health history, Tell them about any family history of cancer, any other health conditions you have, and any medications you're taking. And of course, if you're having any unusual symptoms, definitely bring those up.
Like what kinds of symptoms?
So things like changes in your bowel habits, if you're having diarrhea or constipation that just won't go away, any blood in your stool, unexplained pain in your abdomen, or if you're losing weight without trying. Those are all red flags, and you definitely want to get them checked out.
Always better to be safe than sorry, right?
Yeah.
Even if it turns out to be nothing.
I always say that when it comes to colorectal cancer, early detection is key.
And, even if you're under 45 and feeling great, it's never too early to start thinking about this and having those conversations with your doctor.
Couldn't agree more.
Now, besides the risk score itself, was there anything else in this study that really jumped out at you?
Actually, yeah. The researchers also looked into the types of precancerous growths that were found during those colonoscopies. And what they found was kind of interesting. A lot of these growths, they were what we call sessile serrated polyps.
Sessile serrated polyps. That's a mouthful. What are those exactly?
So they're a particular type of polyp that tends to grow flat against the colon wall, which unfortunately makes them harder to spot during a colonoscopy. And to make matters worse, they also have a higher chance of turning into cancer compared to some other types of polyps.
Oh, wow. So even if someone gets a colonoscopy, there's still a chance these tricky little polyps could be missed.
There's always that possibility, yeah. That's why it's so important for those gastroenterologists, the doctors doing the colonoscopies, to be really thorough and use the best imaging techniques to make sure they don't miss anything.
It sounds like we need to keep pushing for better and better screening methods.
I agree. This study shows us that it's not just about starting screenings at the right time. It's also about making sure those screenings are as accurate and effective as possible.
It's like a two-pronged attack, right?
Yeah.
Early detection and better technology, they have to work together.
Exactly. And who knows, maybe this research will pave the way for even more personalized screening approaches down the road. Screenings that are tailor-made for each person's individual risk factors and polyp type.
That would be amazing. This study has given us so much to think about. Those increasing rates of early-onset colorectal cancer, the incredible research that's helping us find people at risk, those limitations that we need to keep in mind, and all the potential for the future.
It's a good reminder that science is always moving forward, right? We're learning new things, adapting, and always trying to improve how we care for patients.
But it's not just about the science, right? There are real people behind those numbers.
Absolutely. Behind all the statistics and the research findings, there are real people who are facing a really tough diagnosis.
And that brings us to something really important: access to healthcare. We've been talking about all this incredible research and how it could totally change how we find colorectal cancer early. But what happens when people just can't get access to these new advancements?
That's such a huge point. Having all these amazing tools and this knowledge, it's only part of the story. If people can't afford screenings, if insurance doesn't cover it, or if they just don't have a way to see those specialists, well, these discoveries, they don't really help, do they?
It's like we've got the cure for a disease, but we can't get the medicine to the people who need it.
You said it. And this actually ties back to those disparities we were talking about earlier. Unfortunately, the people who are already at higher risk for this early onset colorectal cancer because of genetics or lifestyle stuff, they're often the ones who have the hardest time getting health care in the first place. It's a tough cycle to break.
So it's not just about focusing on the science, right?
Yeah.
We also have to figure out how to fix these bigger issues, these systemic issues that prevent people from getting the care they need.
I'm right there with you. We've got to push for policies that make healthcare more affordable, more accessible for everyone, no matter who they are or how much money they make.
It's about making sure everyone has an equal shot at a healthy life.
Yeah.
But on a more personal level, what can people do if they're facing these barriers?
Even when it feels like you're up against a wall, there are things you can do. Be your own advocate. Talk to your doctor, ask all the questions you have, and don't be shy about bringing up any concerns, even if you're younger than that, that recommended screening age.
And what about the cost? I mean, what if people are worried about that?
Yeah, and that's a legitimate concern, but, don't be afraid to look into different options. There might be free or low-cost screening programs right there in your community.
That's a great reminder. So many organizations and clinics offer screenings for free or at a lower cost if you qualify. It's worth, spending a little time researching what's available near you.
Absolutely.
Now, screenings aside, is there anything else, like lifestyle changes or anything like that people can do to maybe lower their risk?
Oh, absolutely. There are definitely things you can do to take control. Maintaining a healthy weight, Eating a balanced diet and getting some exercise, that's always a good place to start. And we can't forget about quitting smoking. That's huge.
It's funny, it's like those basic healthy habits, we all know about them, but sometimes we need that little reminder.
So true. Even little changes, if you do them consistently, they can really add up and make a big difference in the long run.
So it's not just one thing, right? It's about science moving forward, making healthcare easier to get, and people taking charge of their own health. It all works together.
Exactly. It's not an either-or situation. We need to come at this from all sides.
This deep dive, wow, it's really been an eye-opener for me. We've talked about so much. The fact that early onset colorectal cancer is on the rise, the amazing research that's helping us get better at finding it and preventing it, the roadblocks that we still need to overcome, and all the hope that comes with scientific progress and people taking action.
And it's that hope that I really want our listeners to take away from this. While these rising rates are definitely concerning, the research that's happening right now is so promising. We're learning more and more about this disease. We're developing better tools to find it and treat it. And we're working hard to make sure everyone has a chance to benefit from these advancements.
It's been awesome exploring this with you. As we wrap up this deep dive, we encourage everyone listening, stay informed, stay proactive, and stay hopeful.
Your health is so precious. Take good care of it, and don't be afraid to speak up for yourself.
And on that note, that's a wrap on our deep dive. We'll be back next time to explore another fascinating corner of the world around us.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.